Ashley with MyNationOnline.com. Today we're going to talk about the November 18th presidential debate with the Democrats and focus on the issue of health care. Watch the clips from the debate we're about to show you and see if you can tell the difference between Clinton, Obama, and Edwards' proposed health care plans.
Right now, we need a different kind of politics. Everywhere I go, all throughout Nevada, people are struggling with health care. People are working harder for less. They are having a tougher time saving, tougher time retiring. And part of the reason is because they don't feel that Washington is listening to them. And what I want to do in this campaign is make certain that we are breaking out of the gridlock and partisanship and the standard practices of Washington and actually start listening to the American people to get things done.
Senator Clinton, you want to respond?
Well, I hear what Senator Obama is saying, and he talks a lot about stepping up and taking responsibility and taking strong positions. But when it came time to step up and decide whether or not he would support universal health care coverage, he chose not to do that. His plan would leave 15 million Americans out. That's about the population of Nevada, Iowa, South Carolina, and New Hampshire. I have a universal health care plan that covers everyone. I've been fighting this battle against the special interests for more than 15 years, and I am proud to fight this battle. You know, we can have a different politics, but let's not forget here that the people who we're against are not going to be giving up without a fight. The Republicans are not going to vacate the White House voluntarily. We have some big issues ahead of us, and we need someone who is tested and ready to lead. I think that's what my candidacy offers.
All right, Senator Obama.
Well, let's talk about health care right now. Because the fact of the matter is that I do provide universal health care. The only difference between Senator Clinton's health care plan and mine is that she thinks the problem for people without health care is that nobody has forced them to get health care. That's not what I'm seeing around Nevada. What I see are people who would love to have health care. They desperately want it. But the problem is they can't afford it, which is why we have put forward legislation. We put forward a plan that makes sure that it is affordable to get health care that is as good as the health care that I have as a member of Congress.
All right.
That's what the American people are looking for. That's what they deserve. And that's why I intend to provide as President of the United States.
I cannot let that go unanswered. You know, the most important thing here is to level with the American people. Senator Obama's health care plan does not cover everyone. He starts with children, which is admirable. I helped to create the Children's Health Insurance Program back in 1997. I'm totally committed to making sure every single child is covered. He does not mandate the kind of coverage that I do, and I provide a health care tax credit under my American Health Choices plan so that every American will be able to afford the health care. I open up the congressional plan, but there's a big difference between Senator Obama and me. He starts from the premise of not reaching universal health care.
Hold on, one at a time.
No, I understand, but look, I'm not going to...
Senator Obama, we're going to have a lot more on health care, but go ahead, go ahead.
I will be very brief on this issue. Hillary states that she wants to mandate health care coverage, but she's not garnishing people's wages to make sure that they have it.
All right.
She's not...
Okay, please.
She is...
Go ahead, Senator.
She is not enforcing this mandate. And I don't think that the problem with the American people is that they are not being forced to get health care. The problem is they can't afford it, and that is why my plan provides the mechanism to make sure that they can.
What I believe is important is that we put forth what we stand for. I have been active for 35 years. The American people know where I stand. You know, Senator Edwards raised health care again. When Senator Edwards ran in 2004, he wasn't for universal health care. I'm glad he is now. But for him to be throwing this mud and making these charges, I think really detracts from what we're trying to do here tonight. We need to put forth a positive agenda for America, telling people what we're going to do when we
Senator
get
Edwards,
the
we're going to give you...
Now, from what the candidates were saying on the stage that night, I can't really tell whose plan I support. So I decided to go to their website and research each health care plan and see what each candidate has to offer. Let's take a look. Obama's health care plan proposal. Provide affordable and comprehensive health care for all, regardless of their condition. Expand Medicaid and S-CHIP. Cover all children and provide affordable plans for small businesses and individuals. Giving people the option and guarantee to enroll in a private or public plan, and requiring employees to make a meaningful contribution to employees' coverage. Providing a savings of $2,500 each year by adopting a state-of-the-art information technology system, improving preventative care, and lowering drug costs by allowing drugs from other countries and generic drug use. Clinton's healthcare proposal. Offering new coverage options for all people by providing the same plan as the members of Congress receive. Lowering premiums and increasing security regardless of the job or illness, and ending health care discrimination. Promoting shared responsibility among government, individuals, and insurance companies to insure all people. Ensure affordable health care coverage for all by providing tax relief for small businesses, premium payments based on income, and strengthening Medicaid and S-CHIP. Edwards Health Care Plan. Coverage with shared responsibilities for businesses, government, healthcare markets, and individuals to ensure all people are insured. Affordable and accountable health care to help doctors deliver the best care and invest in preventative care. So from the looks at it, each candidate's plan seems almost identical to the other one. And maybe that's not a bad thing, especially if everyone is covered with health care. But I'm tired of the candidates sitting on the stage pretending like their plan is offering something that it's not, and that it's so much different from their opposition. But we want to know what candidates' health care plans would look like in your nation. Go to mynationonline.com and submit your video blog. Tell us what your candidate would stand for and what their health care plan would look like. We want to know what health care looks like in your nation.